Good afternoon. Welcome to Facebook Live at Henry Ford Health System. My name is Dave Olajars. I'm the Manager of Media Relations. Today's topic is surgery during the COVID pandemic. I'm pleased to welcome for today's discussion Dr. Stephen Kalkanis. Dr. Kalkanis is the CEO of the Henry Ford Medical Group. He is also Senior Vice President and Chief Academic Officer for the health system. And additionally, he is the Chair of Neurosurgery for Henry Ford. Dr. Kalkanis, welcome.
Thank you.
Before we get started, a couple housekeeping items for those watching at home. Don't forget to turn on your sound. Secondly, please be mindful of the disclaimer at the top of this thread. And lastly, as many of you know, everybody's working from home these days. So if you encounter any kind of static or interruptions in service, please hang in there with us. And we appreciate you being here today. Dr. Kalkanis, before we get started, could you sort of share some of your personal perspective about what's happening out there?
Sure. Thank you, David, and thanks to everyone who's watching. You know, this is an unprecedented time that we're going through. We're all going through it together. I continue to be inspired every single day by what I'm calling the heroes of our time, and these are the healthcare workers on the front lines who are making our communities safe. We've committed at Henry Ford to making sure all of our employees and healthcare workers have the equipment that they need to perform their jobs and to do what needs to be done for this crisis. But I tell my team every day that for 105 years, Henry Ford Health System is a place where miracles happen. We've been the ingenious innovator for medicine for over a century, and this COVID challenge is no match for our team. And so I remain very confident. We are calm, we are ready. We are bracing for a surge because we do follow closely the numbers in our community, so we're making all of the necessary arrangements. But our team is in place, and I believe that we are going to weather this storm, and we'll get through to the other side, hopefully, as soon as possible.
Thank you for that. Quick reminder to the folks watching, for the latest information about COVID-19, feel free to go to henryford.com. We also have a patient hotline set up, and that phone number is 313-874-1055, and that number is being answered from between the hours of 8 a.m. to 5 p.m. Monday through Friday. So, Dr. Kalkanis, let's kind of begin the conversation with how are we defining surgeries during this time right now from those who are sort of time sensitive, the emergent type of surgeries, versus those who are non-essential?
Yeah, it's a great question, and I want to focus on that phrase, time sensitive, because for all of our patients, every surgery is essential, every visit is essential. But what we have to ask in this unusual time is, does this procedure or this appointment or this surgery need to take place in the next few hours or days, or could it potentially wait and still maintain safety and a good outcome for our patients? And the reason we're doing this, of course, is that we need to preserve our operating room and ICU capacity as well as our ventilator capacity for our very sick COVID patients who are infected with this virus. And so we have said across the board that in a rolling 2-week basis, we are stopping all scheduled surgeries and procedures unless someone's life depends on it. And in that regard, Henry Ford is here to deliver on whatever we need to keep those patients safe. And if patients do have an emergent or urgent procedure that needs to be done, we absolutely are still performing those cases.
What procedures are defined as non-essential, and how are they being postponed? If you can kind of walk us through that process.
Sure. So many surgeries are planned elective procedures that are scheduled, weeks and months in advance. And so by definition, if someone's scheduled in my world, for instance, an elective spine surgery, or perhaps an elective plastic surgical procedure, or bariatric surgery, or something that is a process that takes weeks to schedule. Our thought would be that waiting another couple of weeks would not harm that individual, and we need to use that capacity. On the other hand, if someone is in the midst of having symptoms of a stroke or significant cardiac disease, if they have a brain tumor that's causing immediate swelling, if they're in a trauma, if there are any range of procedures that need emergent attention, Henry Ford is the place to handle those things. And so we are maintaining that capability, but we want to be very judicious about the resources that we have.
Do you have a sense of, in terms of what percentage of surgeries have been postponed at this point?
Well, again, we have essentially put on hold all surgeries other than those that are emergent or need to be done in the next couple of weeks. And so that's greater than 90+% of our usual case volume. But we are looking very closely at monitoring resources to determine when we can start reopening those schedules. And I think the most transparent and up-to-date answer we can give right now is that we're reevaluating everything on a 2-week rolling basis.
In terms of those surgeries being canceled, are these affected at both the hospital level as well as some of the outpatient surgery centers that we have?
This is a great question. It's across the board. Wherever there's a blue sign in Henry Ford Health System, from Jackson to Macomb, from Wyandotte to West Bloomfield to Detroit at our main campus, to all of our 50+ medical centers, we have the same speaking with one voice policy, and we will reopen those scheduled surgeries as soon as it's safe to do so.
In terms of somebody having a surgery during this time of the COVID pandemic, what's your message to patients who, as I'm sure expected, there's going to be some anxiety there?
Sure. I want patients to hear me directly on this, because we know how, for your life and for your family and for your world, these surgeries that have been postponed, these procedures are time critical and sensitive. We know that this causes stress. We also want you to know that we need to protect you, and we don't want to bring you into a situation where you could be at higher risk for contracting this virus. We want to be prepared with the best teams who would be available to safely and with the best possible outcome provide services to you. And so we need to weather this storm, and we will assure you that we are monitoring not just by the type of surgery or by location, but on an individual patient basis, which ones are truly time sensitive. And I want patients to know that their actual physicians and surgeons have evaluated their individual case to determine if it's safe to wait or not. And so I want people to be reassured that we are monitoring this in real time, and if patient symptoms change or if their situations become more urgent, then of course we will act and take care of them, but we don't want to put people at risk in any undue way.
Are there any different precautions that the surgery team takes today, given the circumstances?
Yes, the personal protective equipment mandate is in full effect, with all types of safety and protective gear for our teams as well as for patients. You can imagine that intubating a patient and putting them on a ventilator for a procedure is a very high risk for aerosolizing these droplets of the virus. So our teams are taking great precaution for the patients and for themselves and for their families. So there's an entire protocol that's been approved, and I'm happy today to announce that as a system, we've gone to a universal mask policy. So for healthcare workers who, even those who may not be in direct contact with patients, if you walk in the door to any Henry Ford Health System facility, you'll be given a mask for safety purposes, and we feel that this will further help protect our team.
Just a reminder for you folks watching that for any questions you may have about COVID-19, feel free to call our patient hotline at 313-874-1055. The hotline is available from 8 a.m. to 5 p.m. Monday through Friday. How about surgeries, Dr. Kalkanis, like organ transplant, very complex, similar to the brain surgeries that you perform. How are those affected these days?
Well, transplant surgeries in particular are very close to the top of the list for things that we're trying to proceed with and fast track. We realize that when organs become available, we don't have the luxury of waiting for COVID, and so we've created these clean areas, so to speak, where we can safely do these procedures. But again, the lens that we're looking through for all of these complex procedures is, can this procedure legitimately wait for hours, days, or a week or two? And if the answer is yes, we don't want to put our patients or our teams at unnecessary risk. But if the answer is no, we're finding a way to do these surgeries very safely.
Which goes to the question that Emily just raised online here for us. Can we assure patients that they're going to be safe in the hospital should they need to have a surgery?
This, in fact, is probably one of the safest places to be outside of your own home because of all of the precautions that we're taking. We have maintained a sterile field and protective environments in all of our procedure areas, and all of our staff now has personal protective equipment, and the sterilization techniques are, as we've always done, in full effect. So yeah, we have no concerns about patients coming in to the hospital who are not infected, but again, it's imperative that this concept of social distancing and of adhering to the governor's order is strictly followed, and it's really for everyone's safety. And I think that the sooner we can all shelter in place, as it were, the sooner this pandemic will pass and we can get back to our normal lives. But for those who need to be here, this is probably the safest place to be.
This question comes from Sheila. Do we have any sense of timing when some of these surgeries will be rescheduled for patients?
I wish I could give everyone an exact date. That's the question of the hour. Again, we're doing this on a rolling 2-week basis, and every day we have, actually multiple times a day, a huddle to look at our curves and metrics and numbers to figure out where we are, and we're following this situation closely. I can assure you that literally the moment that we can reopen our scheduled business, we certainly will, but at this point we're likely at least 2 weeks out.
This is a question from Nanette. She says that I need hip replacement surgery and was already canceled a couple weeks ago. It's now scheduled for April 18th. She's asking, will it be safe by then?
The answer is I hope so, but I can't guarantee it. And I think that we will certainly know more in the next week to 10 days about how far into April we will be able to schedule. When her surgery was likely postponed, that week in April, that third week in April was probably the first date where we were pushing scheduled surgeries out. We hope we can honor that, but events locally and nationally will determine where we are by then.
Are there some common concerns that have been shared with you, Dr. Kalkanis, from some of your patients?
I get called every day by patients, by family members, by people on my team. How bad is this? Are we going to make it through? And should I be really scared about this? And I'm not feeling well for whatever ailment. Are there going to be people there to take care of me? The answer is yes. We're going to weather this storm. We're going to come out stronger at the end of it. We're learning a lot about this disease and our medical field's response to it. I'm very proud of the team here and the way they've handled it. And as always, our patients are first. And I think that, again, the message to our patients is that we are here for you. We have video on-demand visits. We have virtual visits. Our physicians are available and ready to communicate with you through Skype, through MyChart on demand, through our hotline. So we are as connected as we possibly can be in these unusual times, but we are here, and we believe, as always, our patients come first, and that's our goal.
As a reminder to you folks watching, our hotline is 313-874-1055. That hotline's available from 8 a.m. to 5 p.m. Monday through Friday. Dr. Kalkanis, this question came from Nate. He's asking about the types of surgeries. We know all the advances in medicine nowadays, robotic surgeries versus laparoscopic versus traditional methods. Does the type of surgery impact whether or not we go forward with the surgery?
Yeah. Another great question. It's not so much the type of surgery. Again, the one litmus test that we're using is, can this patient wait? It's really a timing issue. And so it's based on the individual patient's condition. You know, how serious is the condition? How sick is the patient? We have capability here to do everything from the most complex to the most, quote, simple of surgery. So that's not the issue. It's a matter of those precious resources and the risk of bringing, you know, patients out of their homes during this period of time. Can this individual safely wait? So again, every one of these decisions is reviewed by that patient's individual doctor to determine the timing.
And in terms of those patients who have surgery, we know there are visitor restrictions in place at our hospitals. How does that play into this for family members who want to come visit their loved ones?
This is probably one of the most stressful and heart-wrenching decisions we've had to make, but you know, when a loved one is in the hospital for whatever reason, family support and support from friends and the community is critical to, you know, create that connectivity between the medical care team and with patients and families. But in this particular crisis, every visitor is an opportunity to spread the virus and to make this place unsafe for our patients. So we had to make the very difficult decision to have an extremely strict visitor policy. We hope that our community will understand why we're doing this, and we've made every effort to connect our inpatients with their loved ones via all types of, you can imagine what's available to us here today in terms of online and video connectivity, but we have to maintain those protocols until we're through this challenge.
For those who are coming into the hospital for a surgery, should they have any added concern for risk of infection from COVID?
Absolutely not. Well, I mean, every time, you know, we go out into the community, there's a risk in the time in which we're living. But beyond that, this is probably the safest place that one could be, and we've taken every possible precaution to ensure that.
On a personal note, Dr. Kalkanis, how are you sort of finding your way, you and your family finding your way through this situation?
It's an unprecedented time. You know, I have my wife and I have 3 small children at home, and we're trying hard to make sure everyone's not going stir crazy at home, and to you know, find activities. The kids are glued to screens on a good day, and so now we're channeling that through online school activities, trying to get some exercise and sanity. But I think that maybe one of the silver linings for all of this is that all of us are maybe learning to appreciate the simplicity in life, and maybe when we strip away all of the things of our daily life, we can reconnect with those who matter most in our families. And I think that if anything, that's one positive that may come out of that. And I know that I personally draw strength from that, and I hope that our teams do as well, because we need that support. I know that a lot of people in our community are hurting and are under extremely difficult stress periods right now, and so we're trying to provide as much support as we can.
This is a question from Whitney. She asks, what about a GJ feeding tube migration? My J tube has migrated into my stomach for a 5th time, and it's excruciating painful.
Yeah, so these are the types of questions where it would be great to connect with that individual physician on a video chat so that they can actually take a look and see what's going on, to understand the symptoms. There may be, in that particular case, a relatively simple solution. It may be possible to send a visiting nurse home or to come in for a quick visit if it becomes more urgent. But again, this is the exact reason why we've set up this telehealth capability to answer these types of questions.
I think we're sort of heading to the closing out our discussion today. But before we do that, Dr. Kalkanis, any sort of closing thoughts that you wanted to share with those watching today?
this is 2020 in the United States of America. We have the greatest healthcare system in the world, and Henry Ford is really at the tip of the spear in solving this crisis. And we've got this. This is a challenging time. We understand the stress that people are under, but I have every confidence that we will make it through. And we really need everybody to help us help you. And there's a great social media post of a bunch of healthcare workers with a sign that says, we showed up and came here for you, please stay home for us. And I think that as long as everyone can maintain that, we're going to come through this stronger than we were before.
Dr. Kalkanis, I want to thank you for spending some time with us today. For those who are watching and for your questions, thank you. A lot of great questions from you folks. For the latest information about COVID, feel free to go to our website, henryford.com/coronavirus. And one final reminder about our phone number, 313-874-1055. That's our patient hotline number. And you can call them between 8 a.m. and 5 p.m. Monday through Friday. One final thought before we sign off. Stay healthy, stay safe, make sure you wash your hands.